Is abnormal bleeding normal during menopause? Many women wonder about the changes in their bodies during menopause, especially when it comes to bleeding. So, is abnormal bleeding normal during this time? Let's break it down. During menopause and the phase leading up to it, known as perimenopause, many women notice changes in their menstrual cycles. This can include irregular bleeding, spotting between periods, or variations in the flow and color of menstrual blood. These changes are often due to fluctuating hormone levels, particularly estrogen and progesterone, as the ovaries begin to produce less of these hormones. Generally, these irregularities are considered normal and part of the natural transition into menopause. However, once a woman officially reaches menopause, which is defined as having no menstrual period for 12 consecutive months, any bleeding or spotting that occurs is not considered normal. This postmenopausal bleeding should always be evaluated by a healthcare provider. It can be a sign of underlying conditions, including endometrial cancer, which is the most common cause of abnormal bleeding after menopause. Other potential causes may include benign growths like polyps or effects from hormone therapy. Due to the risk of serious conditions, any bleeding after menopause should prompt a visit to a healthcare professional for assessment. It is important to pay attention to your body during this time. While irregular bleeding during perimenopause is often benign, persistent or heavy bleeding, especially after menopause, can indicate more serious reproductive health issues. Women with a history or risk factors for reproductive cancers should be particularly vigilant and seek medical evaluation for any abnormal bleeding. In summary, irregular bleeding during perimenopause is common and usually normal due to hormonal changes. However, any bleeding after menopause is not normal and requires medical attention to rule out serious conditions. Women experiencing abnormal bleeding should not ignore these symptoms and should consult a healthcare professional for personalized advice and appropriate management. Staying aware of your bleeding patterns and seeking medical guidance when needed is essential for your health during and after the menopausal transition.